this video, we're going to show scanning a double arch, bite block, bite registration, which we'll talk a little bit more about particular bite registration. Bite block, and the goal is to go to a final denture. So let's set up this case. Okay, now whenever we scan dentures, and we mention this in all of our videos, that you always want to pick scan only. We don't want to pick denture, ortho, splint, anything else. Just pick scan only in the 3Shape Trios software. There are other systems out there that have other optimal settings for dentures, but we just want the surfaces. So we're going to scan, and we pretty much always start with the maxillary. All right, we've already calibrated. Start with the upper. Okay, when we scan a denture, we always scan with the Intaglio first, and then we spin around to the occlusal. And in this case, so this was initially a triad base, which is very common. We have a lot of doctors who actually make their own bases and bite blocks these days, but this was ours because of the white wax. Most doctors don't use white wax. We do. It's a little bit softer, easier to mold. So we sent this out, and it had a little fit issue. So the doctor did a reline impression, and we're going to scan the reline impression and scan the wax. Now, just one criticism here. Really would like to see more defined marks. I think there's a little mark there for the cuspid, little mark for the midline. You can't see them really well. So you really want to make those defined. And also a high smile line. That really helps a lot. And then a photograph, with the bite blocks in place, because we bring those into the software. Okay, let's scan the upper. And as I mentioned, we always scan the Intaglio first, whether it's a tooth scan or whether it's an edenture, a bite block scan. All right, so this is a pretty shiny surface, this material, but it's not as shiny as acrylic, so it really should scan very well. And whenever we scan a denture, we always want to scan. We want to scan a little bit of the old and a little bit of the new. In other words, that white box, that green box, ought to capture something that's already been captured and then something new. You don't want to just pioneer off into a new area of the denture without also grabbing some of the older. Now you can see I'm going to tuck this tip down into the undercut. There we go. Okay, and we want to do denture scans pretty quickly because the software really starts to fill up with scans quickly. Because we're doing a 360 scan, it's a lot of data as compared to just scanning the teeth for a dentate case. When you're scanning a denture, you're scanning a lot of surface, so there's a lot of images and a lot of data. So just go as quickly as you can. Okay, and when you scan those borders, you want to do a little rolling action, just like we were doing. And you come back around and scan the border and the bite block at the same time. You can see how you're capturing both. The scanner is actually slowing down a little bit right now because there's an awful lot of scans here. Actually, it's going okay. Okay, so it scans wax really nicely. Shoot, I kind of jumped around there. Scans wax nicely, even though it's shiny and somewhat of a translucent material where it's thin, but it has nice surface reflection. Okay. Missing a little bit there. We'll come back and try to get that distal in a little bit. Let's come back and scan the occlusal, and we're scanning some of the labial and the occlusal at the same time. And do a little rolling action here. Really want to get done with this scan very quickly now. We're going to probably get a little warning about volume of scans. All right, doing good. You see how easy it is to roll over to the occlusal side. You can pick that up. That's probably acquired. Even though it looks like there's a hole, that's probably good enough. And on the palette, if for some reason the palette is a process base or a finish base and you're still doing a digital process, you can skip the tongue side of the palette. If you're really struggling to capture it, just skip it. As long as we have the Intaglio perfectly captured, you don't really need the tongue side. Because we're going to make a virtual model from the Intaglio side. Okay, so I'm going to do a little rolling action back here in the palette. Capture that perfectly. Here we go. Let me skip over here. There we go. A little bit of rolling. I just noticed on the anterior we missed some of the undercut, so I'm going to go back and capture that. Okay, so let's go. You can see it up there in the anterior. One more little swipe here. Never want to have any holes. Okay, that scan looks good. That's a beautiful scan. Of course, our goal is to go to final. All right, so we want this as just as accurate as possible. So we're going to scan the lower next, which is the no wash. So it must have fit pretty well. And then you can see there's a couple of notches in here, and we're going to capture this one nicely too, because this is also going to final, upper and lower final. Okay, lower scan. As always, we're going to scan the Intaglio first. I'll turn the volume down on the scanner. Don't need to listen to all that noise. All right, this one should go quickly. All the surfaces are rough. Pick that up again. I should have tried to keep going in a very, very smooth motion. I kind of missed my cue there a little bit. Okay, let's come around and scan the borders, and like we always do, we scan some of the Intaglio and some of the labial at the same time. So that green box always has some of the old scan and some of the new scan in it together. All right, that was easy. And then I'm going to spin it around. I'm going to hold it a little bit differently now. Let's pick up where we were. Okay, and let's come around the labial. This should go very quickly here. I'm going to switch fingers, a little tricky. There we go. Keep that green box on some of the old, some of the new, and the scan will go fast, and you will not lose your spot or your orientation. There we go. It's probably a little shiny, a little reflective. You see how it sometimes struggles a little bit? I'm going to go back, and I'm going to scan this labial here. Get reoriented. There we go. Okay, scan the Intaglio. Actually, I'm going to stick to my rule here. I'm going to come back across the occlusal. So I can see we're struggling a little bit in this area. I'm going to slow it down and try to keep it real steady. Okay, let's go around to the lingual. I think we're going to be okay. Even though it had a little bit of a struggle in that area, I think we're going to be okay. I think a lot of these scanners really struggle with some colors. And of course, reflection is always a bit of a struggle with it, especially on shiny denture bases. Okay, I'm going to try to come around here on the lingual and really try to tie that all together. If I can, maybe. Okay, believe it or not, I think that that is going to be just fine because everything else is stitching. If it was a major stitching problem where I didn't think the left and the right were coming together perfectly, I would probably start over. But this denture was scanned just fine. Okay, so we're not going to worry about that. We're not going to worry about that hole right there. The rest of the denture came together fine. Okay. So the next step is to, in this case, the doctor took a bite, and you're going to take a bite chair side sometimes, because you'll see what I mean. The posterior of this case is having a little bit of an issue with the wax not contacting. So you can take a wax bite a PVS bite as normal, and then orient the two together. All right, just so. And what you'll want to do is you'll want to trim away the impression material away from the labial where you're going to scan the bite, because this and this will confuse the scanner, because this was not scanned when you scanned the upper and the lower. It didn't scan the bite. This is a new object and it'll confuse it. So we are simply going to scan in this area. In fact, I'm going to tear that little piece off there. And let's hope that this is enough to capture the bite. I'm going to hold it very steady for this scan. Now, one thing to remember with bite registrations, if for some reason this will just not capture the upper and lower, you see how it's kind of struggling, I'm going to go up here to the reline, so it should be able to recognize that arch. Let's see if it does. Okay, it's definitely struggling to capture this. That's okay though, because this bite is going to come in as a third scan. And what that means is that we can manually put these together if it's not picking up. And I figured it would probably struggle with a bite block because it doesn't have a lot of defined surface. Let me see here. It's lost its orientation. See if I can get this to pick it up again. Yeah, it definitely lost its orientation. So what we're going to do is we're going to delete this bite, and we're going to take another one. Here, let me just show you what happened here. You can see it started scanning again in a different position right here. That's okay. We're going to delete it, and what we're going to do is we're going to come back and scan the bite again, but this time we're just going to scan the surfaces, these two quadrants right here, this whole anterior quadrant, and then we're going to leave it at that. If it won't register, it's okay. We have software that will bring the upper and lower together, and then we can manually make sure that it's perfect. All right, so there's upper. There's a little bit of that bite registration. That's okay. We will see that when we're scanning, when we're registering. Come back around. Make this a wide bite because it's a manual deal, so we want to be able to essentially virtually tripod it, so you don't want just a little spot bite. And just for the heck of it, I'm going to, oh, look at that. So that grabbed the lower. That's nice. And let's go see if we can go back to the midline. Now we have enough here to register it. I was hoping I could just somehow capture that that upper. Okay, let's not push our luck. The bite that we captured, this, you see this, we will be able to orient this upper digitally down into here and bring the two together. So that's our scan. And as I mentioned before, our goal is to take these two bite blocks and go to final. We've made thousands of digital dentures from bite block scans, thousands. And of course, regular digital dentures, but this system works wonderfully. Worst case scenario, you get 2 final dentures. The upper, more than likely, is going to be perfect following your bite block. And if the bite is off, then you can either grind the lower only, take a bite, send it in, and we'll send you a new lower, and then the case will be finished perfectly. If the vertical seems perfect, but the teeth are off a little bit, seat both dentures so that they're fully seated, take a bite, and we'll send you a new lower denture again, or upper and lower, depending on what the situation calls for. But this is a 90% chance, even 95% chance that you're going to go from bite block to final. Thank you.